Hello, my name is Michael Humphrey. I'll be 65 this year. Hi, I'm a patient of Dr. Rao's here at Vascular Solutions in Cary, North Carolina.
My name's Barbara Leeden, and I'm 74 years old, and I live in Raleigh, North Carolina.
My name is Cheryl Aldridge. I'm 65 years old. I'm from Raleigh, North Carolina, and I'm a patient of Dr. Rao's at Vascular Solutions of North Carolina.
My name is Baljeet Burmi. My age is 76, and we live in Morrisville. I'm a patient of Vascular Solutions in North Carolina.
And my name is Dale Blount. I am 68 years old, and I live in Apex, North Carolina.
Maurice Hinton, Raleigh, North Carolina, age 66. I'm a patient of Dr. Rao at Vascular Solutions.
My name is Yogi Lumba. I'm 83 years old. I live in Cary, and I am a patient of Dr. Rao at Vascular Solutions in North Carolina.
My name is Rupal Nishar. I'm 42 and I live in Morrisville, North Carolina. I'm a patient of Dr. Rao's here at Vascular Solutions of North Carolina.
Some of the symptoms I was having dealt with sharp knee pains, going up and down steps.
I've had this pain since I had knee replacement.
I was having issues with my left leg and my left knee.
I had severe arthritis in my left knee and both knees.
I had a lot of pain in my left knee.
I had a knee injury about 7 years ago, and every year I've tried to go to a doctor, different orthopedics or some other specialist to try and figure out how I can resolve my knee issue.
I was in the gym, and I was in the locker room and talking to one of my buddies about the shoulder injury that I had, and the discussion kind of led down to my knee because I have osteoarthritis in my knee.
Later on in the painfulness of it, it started turning into sciatica where I had a hard time even driving down the highway. It was working its way into my hips, and so I needed some solutions.
So I went to a pain management doctor who was familiar with Dr. Rao's procedures and referred me to Dr. Rao's of Vascular Solutions in North Carolina.
But one of my friends had gotten this procedure done from Dr. Rao, and they recommended me to him.
And a gentleman from your facility here overheard the conversation, kind of stepped in and said that he had this new procedure called GAE.
I finally heard about the procedure that Dr. Rao was doing, and that's how I decided to have a conversation with him about if I was a good candidate for the procedure.
For him to check my knee to see if I was eligible for the GAE procedure.
My pain level before the procedure was, according to the chart that we had, was very high. I would say my pain level out of 0 to 10 was probably about a 9.5.
I would estimate my pain was about 8.
I'm not going to say it was a 10. I'll say more like an 8.
Well, I'd say my pain level prior to the procedure was probably around a 6.
5, 6.
5 or 6.
About a 6.
9.5. I had intense amount of pain then, which was very common for me during the day.
I could not walk. I had to use cane to walk.
Sleepless nights, limping.
Not walking as much as getting up and sitting down, and walking up and down stairs was just awful.
My pain was very obvious. My mother is bedridden at home, and I'm her caregiver, and my knee would just almost fold in on me when I was trying to take care of my mom, and it was causing me to not be able to do my daily activities that I normally do.
I typically go on a ski trip somewhere in the world once a year, and I had injections done as well as the gel on my knees prior to going, knowing that that my typical history has been that after skiing the knee flares up, and then within 2 days I'm not able to ski anymore.
In walking and climbing the stairs and descending, I could do only with one foot, not with like that.
I had pain while I was sitting. I had pain while I was lying down. I had, getting up, it needed help. I could not walk without a stick, so
Working out, which was big, even going for a walk, like getting to like 2,000 steps was a big deal. I think some of the other things that I couldn't do was, just keeping up with the kids or doing my household chores that I needed to do, the regular things, or going hiking with the kids.
It was all around difficult to do things with my knee hurting all the time.
I was doing everything, but it was all painful. I mean, I'm not the type to just sit around. I can't sit around. So I was walking my dog, and I was, housework and, getting out and playing bridge and all that kind of thing. But it was painful. I had to put up with it.
I did not want to do the job I was working. I work with the city training new people, and I have to get down there and show them. So it would hurt me the days afterwards to just have mobility. So that pain level was high, very high. The first time I came to the center, we had to examine my knees to make sure it was matching up to what they were looking for.
When I came in about my knee, they asked me some questions and I filled out some paperwork, and my pain doctor that referred me here had already had an x-ray on my knee to find out it was osteoarthritis causing the pain.
Initially we came in, and then I had to wait a month for this surgery.
And that was part due to our schedule too. We might have been able to do it earlier.
I was here getting the echo sound, and I was telling the nurse about my knees. And they said, well, we can do that procedure here.
From the very beginning, I had a lot of information on what the procedure entailed. I liked the fact that we were qualifying and quantifying what the pain was, so we could measure what the improvement would be.
After we first came here, it took us about 5 or 6 weeks before we got our procedure done.
It was about a week after I called, an appointment was made. Came in, Dr. Rule explained the entire procedure.
I had the knee procedure on a Friday, and by, I'd say Thursday, the next Thursday, pain was gone.
The procedure itself it seemed about an hour. It was an option of being knocked out or, just relaxed, a sleepy state, or I could stay awake.
I think I was here for a couple of hours on the day of the procedure from start to finish, so it wasn't a long, intensive procedure at all. It was very minimal. I don't even have a scar or a mark to show for it, it's like a miracle. But it was a very short, straightforward procedure.
It was about a 45-minute procedure, I guess, something along those lines. It really wasn't that long. I was a complete outpatient. I was comfortable during the entire process, and the recovery period was fast, so it was great.
And the procedure was very simple. We came here in the morning at 10 o'clock, and at 12 o'clock I was walking out.
And on the day of the procedure, I felt like, it just felt like a regular day. I could walk in. By the end of the day, I was like walking back out, right, without any assistance or help, which was pretty phenomenal, just given the fact that we'd gone through this procedure.
Vascular Solutions is a great place for doing this procedure. Dr. Ralph, his staff is great.
The people, the operating room was professional.
I was very comfortable during the procedure. We came here, and it was very smooth. The staff was very friendly, and I didn't feel anything at all. There was no pain, nothing. And as I said, in 2 hours, I walked to my car.
There was no pain almost immediately. So I didn't have any issues with that. I was just concerned of overusing it to begin with. So it was maybe about 3 days, 2 days or so that I was icing it down afterwards, after the procedure, and within 2 or 3 days, it was like nothing happened.
I'm feeling great. I mean, I don't even feel any part of pain or anything. So it's like my natural knee, actually, like my natural knee was before I got bone on bone.
I don't have any pain now in my knee. It's like I forgot I had it. It's like a past memory. I forgot the pain was even there before. It's zero with my knee. It doesn't bother me at all. It's wonderful.
Within 30 minutes to 45 minutes, I was comfortable. I got up, moved around, walked, did steps back and forth, turned around, and no pain. Right at that moment, no pain.
I was walking right after my procedure.
It was almost immediate, within 1 week I was doing very well.
I used to take Advil often, anything to subside the pain on a regular basis, which I haven't done at all. Even post-surgery, I didn't need anything. I was absolutely fine, pain-free.
My friends have noticed that I can do much more things. We had planned to go out on cruise and all that, and I had put everything on hold. Now we have decided to go. We are going on a cruise in just a couple of weeks.
It's a godsend. I'm telling you, the procedure was an absolute success. After skiing, I had no pain. There was no inflammation. My range of motion wasn't restricted any longer. It was like there was no problem. So it worked out really well, and I was able to go at least 3 days skiing consecutively without any problems afterwards.
He was in lots of pain. He could not do anything. He will just walk a little, then he will sit down. He wouldn't do anything. And after the procedure, I think within a couple days, actually, he started making tea. He started doing the things around the house, walking. Walking was the main thing. He could not do any. And that wasn't good. But now he walks a lot every day, and he's doing everything.
I would say that if you have any kind of joint pain, I don't know if you can do it on all joints, but I know for the knee and the shoulder for sure, I would give this a try before I even thought about surgery.
Absolutely.
And then if this didn't help, you always can have the surgery.
And I encourage anyone who's suffering with knee pain, reach out to the Vascular Solutions of North Carolina, Dr. Rayos, and ask for a consultation and have a clinical visit to let them decide if this is the right thing for you. It was the right thing for me, and I encourage anyone that's suffering from the same thing I was suffering from to please reach out to Vascular Solutions of North Carolina.
I will advise them to come right over here because you don't have any surgery, any pain or any thing. You can walk right away after the procedure.
My advice to people would be that before they go into the surgery, they should definitely investigate this procedure because it has helped me, and I know other people who it has helped.
The procedure is performed with such clarity, with such ease. There is absolutely nothing to lose here. It's easier than getting your teeth cleaned. It's less painful than that.